your host, Dr. Rahi Victory, a reproductive endocrinology and infertility specialist, with my dear friend Tarek Ibrahim from Ibrahim Strategies Group, who is currently trying to get TikTok up and running because we run on multiple platforms for the show. I hope you guys brought all your questions today. I am fresh back from my holidays. Thank you to my wonderful family who all came from different parts of North America, actually, at present, to come and hang out with us. And to my wonderful middle son's girlfriend, who also flew all the way out to meet us. So that was wonderful as well. I hope you guys had a good July 4th or Canada Day weekend. And if it's one of our friends from Holland, whatever weekend it was out there. Good old Soraya. So we are here to answer questions. I have been scouring the internet for any kind of useful new article. There is one, but it literally came out today and we did not have enough time to pull it together to get it ready for the show. But very interesting study on whether or not you should re-biopsy embryos that were biopsied previously but had no study. They looked at 18,000 embryos in total, of which about 500 were...
Doesn't want to give you a slice of her pie. That's no problem.
It just showed up on its own.
were re-biopsied. And so they looked at whether or not you should re-biopsy the embryos and what the outcomes were and how many survived and so on. So tonight we're going to start taking your questions, straight off the hop and hopefully answer anything you guys have. Like I said, there's no real momentous info. I am headed to ASRM. I'm hoping to connect with some of my colleagues there as well. So that should be interesting coming up soon. And our amazing nurse Lisa won an international prize for VRC for the work that we do at the recent ESHRE, and she was just in Copenhagen. So I haven't had a chance to see her yet, but I understand that that was very successful as well. So if we have questions already, I am ready. Are you still working on TikTok?
Yeah.
Do you want me to just do the live on my phone and then just prop it up?
I can give you a quick question.
Okay.
In your clinic, do you use day 3 or day 5 embryos at your clinic?
Yeah, so most clinics these days no longer use day 3. We do make exceptions. So for example, if we get someone who has repeatedly had failures with day 5s, we'll try on day 3. And there are people that do that. Their embryos just don't grow well in the lab. So in fact, we had one patient in particular, a young lady, whose embryos just didn't do well when you got them to day 5. So we froze some on day 3 for in a subsequent cycle. But as a general rule, the vast majority of clinics globally are now doing day 5 embryos, day 6 embryos. The problem with day 3s is you really don't know what the potential of that embryo to become a successful implantation is. And in reality, there are studies that have shown that it is much better to use a day 5 embryo, because if you're using a day 3 embryo, you will have sort of less success overall than you would with a day 5. So we, for a long time now, I dragged my previous clinic kicking and screaming into doing day 5 embryos. He didn't want to, the embryologist, but I kind of forced it. And so we definitely started using less embryos for transfer with very good success rates. Excuse me. And now that we're doing it here at VRC, we almost need for more than one embryo, and we're still getting phenomenal. So I'm a big on day 5s and do it to make it as safe as possible.
What's that? You okay?
Yeah. Oh, I'm tired, so I lose my voice when I'm tired. A lot of driving lately, so.
Okay.
I was at Niagara Falls yesterday. Oh. Did you know that there's always a rainbow between those two falls? Almost always.
Oh,
yeah.
That's not rare?
I got this wicked picture of the rainbow right between the two falls. It was beautiful. Being there for When was the last time you were in Niagara?
I know where I always go.
You're always there? Oh, yeah.
Like the cheap holiday event.
I've not been there for probably 24 years.
Really?
23,
Oh, wow.
24 years is a long time.
Long time.
Yeah. You know that boat that's in the Niagara River, that metal ship? Apparently,
Oh, really?
they're-
Gone.
I'm thinking that's going to go over one of these days. Yeah.
Dear Dr. VNT, our mutation who is doing an FET, does it vary depending on the mutation we have? Any idea if quadrifolic is the same and as good levofolic acid?
So you're supposed to use 5-methyl acid instead of folate, and it's usually the 5-methyl version for MTHFR. And then we give our patients
Is that better? Yeah, it's good now. I think
Now
it's
they
good.
can hear us?
Yeah.
Okay. That's right, folks. All right. Welcome to the wild world of technology. Behind the scenes here are 1,500 different wires and microphone setups and all sorts of stuff. So, yeah. Okay, go ahead.
Yeah, sure. So they didn't hear the MTHR question answer.
So we use baby aspirin starting with stimulation for the MTHFR mutation. And then if they're homozygous, so they have both copies of the mutant allele, we use aspirin and heparin. As far as the folic acid is concerned, you're supposed to use 5-methylfolinic acid. So that's the one that we use for that.
Well, redo the questions, I guess.
All of them? No, they couldn't hear anything?
No, they heard that the MTHR question.
Oh, okay.
Okay. How long would you recommend trying naturally after a negative result of urea plasma? I'm thinking of scheduling a second embryo transfer, but urea plasma has been the only thing we found wrong.
You could try whenever you wanted. That's not a big deal. Yeah, there's no reason why you can't start right away. If you want to try right away, try right away. I think I have enough charge to keep this going for a little bit.
Vertical?
Yeah.
Okay, hello to the best team. I recently found out I'm pregnant.
Oh, congratulations.
Last period, June 10. Positive test on July 8th. First beta, 1,584 mLu over ml. On the same day, tested today, July 11th, for a total beta of 4,372 and progesterone of 13.73. Should I test beta and prog again in 3 days? Are those considered good numbers? What is your opinion on prog? Should I have my doctor add prog? I have my first appointment July 19. This was an all natural pregnancy after following all your advice on consultations with you.
Yes.
I can't thank you enough.
That's awesome.
Amazing. That's really amazing.
If you have a history of infertility, we do generally use progesterone. So you can go on progesterone if you want. So just vaginal is all we would normally recommend for that. But I wouldn't measure levels. You're getting so much when you take the vaginal progesterone. It's more than enough for a natural pregnancy. Plus, don't forget your body's making its own. With regards to repeating the beta, no. What's it going to do for you? If it's going up, it's normal. And if it's not going up, unfortunately, there's absolutely zero anybody can do. So I find that just drives people crazy. We typically do 1, maximum 2 to make sure it's rising appropriately, and then you're done.
Are you live on TikTok?
Well, it says Tarek Ibrahim joined. I think that's you. So yeah.
Crazy. I don't know why I'm not getting anything. Can you get off and get back on?
I can get off.
Is there any questions on TikTok?
No.
Okay.
Not yet.
All right. Just
I accidentally almost blocked you though.
no.
It keeps saying you're joining. Tarek Ibrahim 519 joined. Is that you?
Wow, you've really outed me on that one. Which strains of lactobacilli and midfidus should we look for in probiotics for modulating fertility, microbiota, or for dysbiosis?
Yeah, so crispatus is the main one, but pretty much most of the lactobacilli are okay. So, but the big one that they talk about a lot is called crispatus. You're really not having a good time with that.
I don't know. I'm wondering. I keep talking to her.
Carly's there, so it must be working.
She's on TikTok?
Yeah, although I don't see a lot of people watching. But
I'm telling you, it's not working right. End it and come back.
Guys, we're going to end our TikTok and come back.
Yeah, good idea. While that's going, does human growth hormone cause cancer?
I'm not aware of any studies that show that human growth hormone does cause cancer. There was a suggestion that it may be linked to breast cancer, but we are way too early into that to have any clear suggestion that that's the case. Keep in mind, everybody has human growth hormone in them. You're taking a small amount for a very short period of time. The chance that that's going to sort of contribute to you getting cancer is literally minimal. So I doubt it. Yeah, very unlikely.
Should you get fibroids removed if they're inside the uterus?
Well, fibroids come in different shapes and sizes. So fibroids that are in the cavity of the uterus or pushing into the cavity of the uterus, they have to be removed. That's a 50% reduction in success and a doubling of your miscarriage risk. And there's lots of meta-analyses, in particular one by Elizabeth Pritz, who's a very brilliant American REI. So yeah, if you have them there, you got to remove them for sure. If they're in the wall of the uterus, it's a little more controversial, but there's more and more evidence amounting that if they're more than 4 centimeters and they're in the wall of the uterus, those also should be removed. If they are in the outer edge, what we call the serosa of the uterus, those generally speaking do not need to be removed. And the ones that are pedunculated, meaning they're dangling off of the surface of the uterus, those also don't need to be removed. But if it's inside the cavity or somehow deflecting or impacting the shape of the inside of the cavity, you have to get rid of those. There's many, many studies that support that and show that.
TikTok's working now.
I see that. Yeah, you were having a
I
frustrating
think a lot of people
time.
are having.
With TikTok?
Mm-hmm.
Yeah, maybe. I didn't do anything different.
I know you didn't.
I got one.
Yeah.
4-day post 6-day transfer and saw a very, very faint line. Oh, VVFL. See, I'm making this stuff
Oh,
up.
good for you.
Go.
Good for
This
you.
afternoon. Triggered 11 days ago. Could this still be the Novarel? Well, if Novarel is GnRH, most definitely not. If Novarel is HCG product, the half-life of HCG is usually over in 5 days. So it should be out of your system if you're 11 days out. That should be a very, very faint line that's real. Easiest way to find out is do a blood test now and do a blood test 2 days later. If it's going up, it's impossible to be anything other than a pregnancy. So that's what you would be looking at.
Ready for this?
Ready. Soraya?
No. Better. Way better.
Way better.
Is it worth doing the ERA if I had a failed FET with a euploid? I have 3 more euploids.
You're just teasing me now.
No,
man.
really. That's the question.
So the ERA, for those of you that have not watched the 10 million programs that we have, is useless. It has been proven to be useless. The company's own trial of the ERA showed that it was useless. Meta-analyses, 2 now, have shown that it is useless. And the most recent meta-analysis, which we reviewed on the show 3 or 4 weeks ago, it wasn't a meta-analysis, it was just a review, not only showed that it was useless, they actually demonstrated very clearly that it resulted in an 11% decrease in success. So if your doctor is still supportive of the ERA, they literally have absolutely no clue what they are doing. If someone is supporting the ERA, it is indefensible. There is not one piece of evidence to support the use of the ERA. The company's own trial demonstrated that it failed. So don't follow the ERA, guys. Do not use it. Don't pay for it. Total waste of money. We need like a really aggressive YouTube video now, a short.
A nice, serious short.
Yeah.
I keep seeing / talking to women who've had 2 subsequent spina bifida pregnancies after IVF.
Oh, wow.
How often do you see this? I'm scared.
I've only ever had 1 spina bifida pregnancy in all the pregnancies that I've managed. So we definitely don't see it very often. But keep in mind, we put all of our patients on prenatal vitamins. And your number 1 risk factor for spina bifida is having low folic acid. So it's a neural tube defect, and as long as you have your folic acid levels high, you're going to avoid those in large part. Nothing's ever 100%, but it's pretty good at avoiding neural tube defects. So I think if you preemptively are on your folic acid for 1 month before trying to conceive, you should cut down your risk to a negligible level. I've never heard of someone having 2 spina bifida cases in a row. And certainly if you did, I'd be worried about genetics. So that's a whole other issue.
I was having before endo in my left ovary. The doc did the laparoscopy. Then after 3 months, I'm having again in my right ovary.
Oh, that's terrible. Some people have very aggressive endo. It's possible it was there and it got missed the first time. It's possible that it's just super aggressive. Super aggressive cases of endo, you don't have time. Like, get on to whatever you're doing, IUI, IVF, fertility care, natural conception, whatever, but get pregnant quickly because it can get really bad really quickly. And I have seen people that have been forced out of the option of doing fertility treatments because of what happened.
Should a probiotic contain bifidobacterium apart from lactobacillus?
Yeah, there are some studies that support that. I can't say that I'm an expert in the specifics of which bacteria need to be there. Obviously, Lactobacillus acidophilus are the big ones. But I think that that's probably a naturopath question more than a Dr. Victory question. I'm reasonably good at all of this natural stuff, but getting down to the nitty gritty of which bacteria need to be there, even I have to turn and read an article to figure that out. I shouldn't say even I too. Is it a bad sign if an embryo is only partially expanded at the time of transfer? Yeah, so there's a good study we reviewed, I want to say like 8 or 9 months ago, which showed that the degree of expansion of the embryo is correlated to your success rate. So it doesn't mean that an unexpanded or not fully expanded embryo won't attach, but it has a lower chance than an embryo that is fully expanded for sure. Good question.
Does estrus pills and progesterone shots cause cancer?
So the fertility medications that go with IVF have been studied extensively, and there is no evidence that it increases your risk of cancer. Infertility increases your risk of cancer, but the treatments and the medications we use do not. Having said that, any unopposed estrogen like estrase for a prolonged period of time will certainly increase your risk of cancer, as will prolonged progesterone exposure. So do we keep people on it forever? No. Now, progesterone's fine in pregnancy, but estrase, we don't keep people on estrase through the whole pregnancy. We stop at 12 weeks.
Hello, T and Dr. V. Is it normal to not check lining thickness the day of transfer? Mine was checked 3 days prior, but not on transfer day.
Yeah, I mean, if you're fine on the day, if you're fine 2 or 3 days prior, we don't recheck it on the day of transfer. It's too late at that point anyway, so you're committed. So we fire ahead. But, we're not guessing it either, right? If you're only 4 millimeters 3 days before, we're going to stop. But if you're 8, 9, 10 millimeters, it's not like you're going to be 5 on the day of transfer.
Before IVF, I used to get my keloid hypertrophic scars injected with steroids.
Yeah.
Can I get them injected again between IVF cycles? Does local injection have systematic effects?
Yeah, that's a good question. So we use a steroid called Kenalog when we're treating keloid scars. And Kenalog is a very potent steroid. So is there going to be some systemic absorption? Yes, there will be, because some of it's going to absorb into your bloodstream and into the fat tissue surrounding your scar. And so there will be some absorption. Is it going to be enough to cause harm to an IVF cycle? I doubt it. But there's clearly no studies on that kind of thing. But I could say I doubt that would be a significant factor. Now, it also depends on how much Kenalog you're using. We use these tiny little needles. We don't even have to give the patients local. You're just jabbing it and it's like repetitive mosquito bites. So not the friendliest thing to do, but tolerable. And we just jab that in maybe 5 or 10 spots over the course of it. And you just kind of inject as you're going. And we use a relatively small amount when we're doing that. If you're really worried, there are laser treatments that can be used. We have it at Revitalized Medical Laser Center here in Windsor, where you can either do microneedling or laser to smooth out the scar. So that's another option as well.
These are from Instagram now. What does a natural modified FEY cycle look like after 3 months of Lupron letrozole for someone with?
Endoadeno.
Yeah, I'm guessing.
So we just extend the letrozole for an extra 5 days, and then we monitor. We're on all the supplements for endo and adeno, and then when your lining gets thick enough, we start the progesterones. If your lining doesn't get thick enough, we use the absolute most minimum amount of estrates, like 1 milligram a day, and that's all you need. You don't need 12 milligrams a day like a lot of places are giving. On top of that, there is a lot of attention to the details of the cycle, making sure everything else, like I said, your supplements and your lining and bringing you in for ultrasound and so on are perfect. So we're very careful about that stuff.
Are day 6 XEXP,
Expanded.
AA blast,
Yeah.
PGTA came back inconclusive due to low quality? Thoughts? I'm 39, sperm pH value 8.5, leukocytes slightly increased, but great morphology and more motility.
That's a great question. So it's very difficult to biopsy a hatching or hatched blast. If it's just expanded, you're probably going to get away with it. But you would have to thaw it, rebiopsy it. So there is an article literally I was going to share with you guys tonight. We just didn't have enough time. And that article suggests that it is safe to rebiopsy, but it's not 100% safe, and you will lose a substantial proportion of embryos. So if it's your only one, remember that the biology here is in your favor. If you just go ahead and transfer the embryo, if it's not normal, it's not going to work most likely. And if it does work, you can always find out if it's not normal. But if you biopsy it again a second time and then refreeze it and then rethaw it and it dies, you've now lost your chance. So we generally do not support rebiopsying embryos. It just logically doesn't make a lot of sense. There is a financial argument to be made based on how many you have. So that's a different story. But if you've only got one or two, it literally is easier and probably way safer for your embryos to just transfer the embryos.
Is there long-term side effects associated with immune treatments like LIT and intralipids?
None that I am aware of. So I've never seen any studies looking at long-term side effects of intralipids or LIT therapy. That doesn't mean there isn't any. Certainly intralipids can damage your liver if you take it for too long. But we're using small amounts once every 6 weeks, so it's not a heavy dose. Keep in mind, intralipids is the one of the 3 ingredients when we're feeding people through an IV, which is a non-stop daily process for people that have issues with their ability to intake food, and we need to keep them alive. So it's called TPN, total parenteral nutrition. So these are people that are getting endless days of intralipids. That's where it comes from. It's the fat content. So when you need to feed someone, you got to give them sugar, you got to give them protein, and you got to give them fat. That's what you need to survive, and obviously water. So you give them a bag of sugar water, which is glucose. You're going to give them a bag of intralipids, and there's a protein bag that we give them as well. So those will all help keep people alive, and they're getting it days and days and days and days and days. So I'm not aware of any long-term side effects from that, other than liver, part of which is from the protein solution in TPN as well. So I don't know of anything. LIT therapy, no one should be getting LIT therapy over and over and over again.
Can you drink cinnamon tea and chai tea when pregnant? Hearing different things about herbal teas.
There are some herbal teas that you cannot drink. I've never heard of cinnamon and chai. If chai tea is a problem, then there wouldn't be any babies born in India, Pakistan, and parts of China. So I don't think that's a huge issue, but you do have to read the label, read the packaging. There are some teas that can contain prostaglandins that can actually force a miscarriage. So you do have to be cautious.
There was this little comedy bit. I
yeah.
forget what I was watching or where I was watching it. But chai in whatever language, is it Punjabi or Hindi or whatever.
Sure.
They said it means tea. So you don't say chai tea. You just say
It's just
chai.
chai.
Yeah, it was like
Yeah.
it was a big comedy. And
So-
then they had something else similar to that again.
So in Persian, chai, we say chai. So it's the same word basically.
Tea.
It's tea.
Yeah,
That's the word.
that's the word for
Like
tea.
my family will say chai Michai, which means do you want tea?
Mm-hmm.
Yeah.
It was in the Spider-Man movie, actually. I think.
I don't remember.
Yeah, somebody was saying, you don't say this. Anyway.
Out of that whole frenetic movie, the one line you remember.
Because I thought it was so comical. I thought it was so funny that they broke down the definition of
chai.
because the Indian Spider-Man had it, and then there was another Spider-Man. You know, there was that Indian Spider-Man, right? You were sleeping in that movie.
I was tired.
In the early, they went to India to fight the guy. It's like fake India.
Yeah.
So they said chai tea, and he had the.
Oh, I got.
He was not happy about it. He was offended, and there was some other culture that was offended as well.
I'll have to watch that again.
Yeah, it went over most people's heads in the theaters, but I caught it. You should start using the hashtag stop using ERA.
That's good. I like that. Excellent suggestion. We will definitely look into that. Stop using ERA.
Thoughts on True Niagen, NAD, and NMN supplementation?
Yeah, there is some evidence for that, so it may be helpful. I don't think the studies on any of those supplements are 100%, but there is some evidence that it might be beneficial. I give all my supplement instructions with a warning, and that warning is that you can't overdo it. So that's actually going to be a short for us very soon. You can't overdo the amount of vitamins and supplements that you take to the point where it's actually damaging. So don't overdo it. You just want like the right amount.
Makes sense.
Yeah, balance in everything.
Everything.
All things in moderation.
Before IBS, I did that one. Hi, Dr. VNT. Yeah.
Yeah.
Hi, Dr. VNT. Are you less likely to have an immune response to embryos than sperm if you have a reaction to the sperm?
Are you less likely to have a negative response to embryos than you are to sperm if you react to the sperm? Is that the question? Yes, because the embryo is only partly made up of that sperm and is partly made up of you, assuming the egg came from you. So yeah, of course you're going to be less likely to react, but depending on how much of the sperm protein is expressed on the surface of the embryo, your immune system may still attack it. I got a TikToker.
Yes, you do.
In my opinion, what are the success chances for 3BB and 3BC untested embryos? So it's impossible to answer those questions. Not that I don't want to. I would love to answer the question. However, it depends on a million different factors. The sperm quality, your partner's age, your age, the chances that the embryos were actually graded appropriately. What is your body mass index? What are your social habits? Do you smoke? Do you drink? Do you use drugs? Did your partner? Does he currently? How many vitamins are you on? Which protocol are they using? So you can never answer a question like what are the chances. It's impossible to answer questions like that.
Hello, Dr. V. How often do you perform tubal reversal surgeries? When do you recommend a TR surgery over IVF? And do you perform the surgery with the Da Vinci robot? Is it an enjoyable surgery to perform?
How often do I do them? Probably 6 to 8 per year, maybe 6 to 10 per year. When do I do it? It's better for younger patients, and it's better for older patients. For the in-between group, it's not great. You're better off going with IVF. Younger patients have a lot longer, so they'll get a lot more benefit out of it. Older patients have much lower chances with IVF, so if they're going to do something, they may as well try that before they jump into doing, expensive IVF and egg donor cases. The in-between group, they probably are better off doing IVF because their chances are going to be good, and cost analysis wise, it's probably reasonable. Do I use the Da Vinci robot? No, I don't use the Da Vinci robot for anything. I actually think the Da Vinci robot's a bit of a joke. The only thing the Da Vinci robot is beneficial for in what we do is when you're doing fibroids laparoscopically. If you're doing a laparoscopic myomectomy, which I don't do, well, at least I don't do them often, then it's useful for sewing the bed of the uterus after you've removed the fibroid. It does make it way easier, there's no question. But for any other kind of procedure, I don't need the Da Vinci robot. It's 3 extra portholes, an hour of extra you asleep anesthesia time, and it does nothing for me. I can do virtually every single procedure without the robot. Better cosmetics, less OR time, less anesthetic exposure, less time with you flat on the bed, less risk of injury. So I don't bother with it. It's not of any value. And I actually don't know of anybody that's using it for tubal reanastomosis. Is it an enjoyable surgery? Yeah, it's really cool because it's so delicate. Like the stitches are so fine that if they're not dyed blue, you can't see them. So it's pretty cool surgery to do. It's very delicate. You got to have very good hands to do it.
Bunch happened here on TikTok. Do you ever do your own studies and trials at your clinic?
We do, and we're starting a couple. Actually, we are in the process of getting an individual to come and work for us for a while to do some research projects for us. So yeah, we're looking at that.
A nurse in hospital refused me my dose of Zofran, telling me it was bad for baby. Why?
No idea. Zofran's fine in pregnancy, so I don't think that's an issue. There's no contraindication to using Zofran.
Hi TQ and Dr. V.
TQ.
Yeah, there you go. My clinic froze my 3 embryos in 1 straw. I'm upset. Can embryos be thawed and refrozen? This was my 3rd cycle, no children yet. I'm disappointed and confused.
Who is that?
That's Laura Cadio.
So Laura, which clinic did you go to? I don't know of anybody except for my old clinic that is doing that. As far as is it possible to thaw and refreeze? Yes. It's just not good for the embryos. So we try to avoid that. It can be okay if the embryos are very high quality. If they're not very high quality, you're running the risk that they will get damaged and not make the thaw, freeze thaw. So it's not ideal. I don't blame you for being upset. I'm sorry you have to go through that. That's terrible.
For CoQ10, ubiquinol, and ubiquinone, same dose? Thank you.
Yeah, it depends on which formulation, and no, it's not the same dose. So ubiquinol, you usually need 600, and ubiquinone is usually like 100. But it depends on the formulation. So there's one formulation where you take 1 pill at 125 milligrams, and it's equivalent to 600 of the other formulations. So CoQ10 is very dependent on where you're getting it from.
Hi. What's the recommended amount of vitamin D to take daily for fertility? Thanks.
2,000 to 4,000 is what we recommend. Get your vitamin D levels checked. That's an easy fix.
What is a good amount of probiotic to take?
Yeah, that's a great question. So nobody knows. So I normally tell people to take whatever the recommended dosing is on whatever probiotic you're taking. But nobody knows. That has not been comparatively studied. Like there are no comparison studies saying if you take, 5 million of this bacteria or 10 million of that one or 20 million of the other one, you're going to have XYZ percentage success rate. It doesn't work like that.
Will sperm morphology 0% NF impact IUI success? Would IVF be indicated instead?
Yeah, it will. I mean, the lower your morphology score, the less usable sperm you have, right? And 0 is concerning. IVF will definitely do better, but actually only if you improve your sperm first. So I'd actually go back and say, why is there such low morphology? Excuse me, and then is there a way that we can fix it?
Are you a fan of embryo glue?
First. I am a fan of embryo glue. We use embryo glue in every single case.
Do you prefer
Proj.
Pessaries or injections?
Pessaries.
Pessaries?
We use the injections and the pessaries both. It's not a pessary, it's just a vaginal insert.
How much melatonin do you recommend prior to IVF?
3 milligrams a day. You can go up to 10, but we just use 3. There's a TikTok question. How far in advance to an FET should you start taking aspirin? With your stim, that's when we start it.
DQ alpha HLA match along with NK cells activation. Can we still have a baby together?
Yeah, you can. There's probably millions of people that have this, but there are different things you should probably look at. But that's still reasonable to consider.
What are your thoughts on causes of SCH? Does IVIG reduce the risk of SCH?
I can't think of any physiologic reason why IVIG would reduce the risk of a subchorionic hemorrhage. Unless there's an immune-mediated vasospastic response, meaning your blood vessels snap shut from some kind of immune signaling, I can't think of why that would work. So I'm not aware of any connection between those two. I have a very cool TikTok question.
Go for
Are you
it.
seeing that?
Yeah.
I've had a torn rotator cuff since January and loads of pain. It's gone with this pregnancy. How? Your pregnancy is a condition in which your immune system quiets down a little bit. And so if your immune system is busy working on the damage in your rotator cuff, it can cause pain during that repair process. So it's entirely possible that the calming of your immune system has reduced the sensitivity of your nerves and your inflammation and the swelling and all of that.
Superman syndrome.
Superman syndrome. I'm pretty sure he was never pregnant too.
Yeah, but strength.
Superman was cool. Who's your favorite superhero?
Batman over Superman anyway.
Really?
Oh yeah.
You like Batman?
Superman.
He's a billionaire in a suit.
Good suit. I can look up
Yeah.
to Bruce Wayne and Batman. That's achievable. I can never be Superman.
Yeah, but that's
Not even human. He's an alien.
He is an alien. That's
Yeah.
true.
I can't be him. But
Yeah.
Batman? Maybe.
I think Spider-Man was probably.
Oh, Spider-Man's also great.
Spider-Man.
I
was
love
very
Spider-Man.
cool.
But I don't like Peter Parker. He messes up everything. But Spider-Man as the superhero, cool guy.
Cool guy.
Yeah.
I like Spider-Man.
Yeah, Spider-Man's great.
Definitely fun.
Iron Man, also great.
Iron Man, very, very cool.
See?
Again, just the guy in a suit, but
Hell of a guy in a suit.
but made legend by Robert Downey Jr. That was cool. Yeah.
Absolutely. He's a great actor, actually.
Yeah. What about all the fans? What do you guys think?
That's a great question.
Spider-Man, Superman, or Batman?
Yeah, that's
or
a great question.
Batgirl, Superwoman, or
They're not as good as the guy ones.
what's the Spider-Girl called?
Spider-Girl?
No, isn't it Gwen?
Yeah, Gwen, but I think she's not known as Gwen.
Spider-Gwen. I think she's called Spider-Gwen. I'm not a
Really?
comic.
Is she actually
think
Spider-Gwen?
she's
Like
called
she
Spider-Gwen.
gives away her first name and her name? I don't think so, right? I think.
She was cute in that movie,
She was super
even
cool.
though she was totally cartoon.
Thor!
Thor. Yeah, that's because they all love
Because they're
Chris
all
Hemsworth.
women. Because they're all women. Next, you're going to tell me that fish guy. What was his name? What was
Aquaman?
it? Aquaman. Also, not a cool hero, but the ladies may like him.
Although Chris Hemsworth is wicked.
Well, that's, yeah.
Yeah.
I can understand that.
Yeah.
All fertility patients are my superheroes.
Oh, that's sweet. I love that.
Why do all men have crushes on cartoon characters?
Because guys grow up. Well, I can't speak for all guys. I can say I grew up wanting to be a superhero one day. I think it's you dream of having superpowers and being able to fly and be stronger than everybody else and faster than everybody else. Nowadays, I have to buy a big expensive sports car to be faster than everybody else. So yeah, it's in my DNA.
So I'll tell you one thing. When
You're like that too.
Absolutely. So one time when I was a kid, and the first time I saw a couple X-Men episodes, I was always in love with Wolverine because I always felt deep down inside that this guy, no matter what, if he's hungry and there was like a chunk of salami, he could just cut it with his bare hands and have a perfect slice. And that was a moment of contention I had with him, that he could do that, and I would always have to reach out for a knife, and he didn't have to.
I can't believe the Batman. That's so funny. My kid can't say that.
See?
Yeah, I know.
Because he's cool.
Yeah,
he
we
can
got.
do that.
We should show people that one day. I have a little picture on my wall that is an art piece, and it's a guy dressed up as Batman, and he's spraying graffiti on a brick wall, and the graffiti says, "Superman is Clark Kent." It's like the coolest thing. So I love that picture. Picked that up in Toronto. There's some. There are some things here.
A lot of people like Spider-Man on Instagram.
Oh, really?
Spider-Man is like the superhero of choice on Instagram.
Carly says I was the fastest swimmer.
Yeah, there you go.
Uh,
Some people like Superman.
Oh, that's so sweet. Kim says you are the best OB in the country. You are a superhero. Thank you, Kim.
There you
That's
go.
very kind of you.
All right, a little bit of a tangent here.
Yeah. That's a good tangent.
That's a great tangent. I even started watching the old Michael Keaton Batman with my kids.
I didn't love the Michael Keaton Batman. Did you like that one?
I just started them. I have to put them on the trajectory. They're going to get disappointed very soon. Val Kilmer's going to show up. George Clooney. It's going to get real bad soon.
But the Christopher Nolan Batman were wicked. They were so good. All three of those
Very
movies
dark.
were phenomenal.
That was amazing.
Yeah.
Back to fertility.
Yep.
What supplements do you generally like to see during pregnancy?
Vitamin D, iron, melatonin, and your fish oils, and then your prenatal. So those are the basic ones everybody should be on. Beyond that, it depends on your condition: PCOS, endometriosis, adenomyosis, so on.
Reasons for Clomid resistance and not being able to produce multiple pregnancies.
Say that again.
Reasons for Clomid resistance and not being able to produce multiple pregnancies.
Well, Clomid resistance is a real thing. It's usually related to the patient's body mass index, but not always. Some people just, their physiology makes them very Clomid resistant. I'm not quite sure I understand your question, but if you're asking why you can't have twins or triplets, nobody should be trying to have twins or triplets. So please don't, that should never be the goal. It is a risky pregnancy. There are all sorts of complications. One of my triplet patients that I saw today who did not do IVF, she got pregnant with triplets. I won't go into the details for privacy reasons, but she is only at 19 weeks and in horrible pain. So it's not an easy pregnancy. There are lots of risks. It's complicated. You got to be really careful, guys. So never aim for multiples. If it happens, God bless you, and I hope it all goes well, and we will take great care of you. But try and avoid aiming for it. That's not a goal. I just had my SIS with you last week.
You're back. Okay.
And should have my consultation with your clinic soon. Very excited. Well, we're excited to have you. Started spotting day 2 of stims for luteal phase egg retrieval. Is this okay? Yeah, it's totally okay because you're in your luteal phase and whatever happens doesn't matter. Remember, we don't care about your lining. It has nothing to do with the stimulation of your ovaries.
If my first untested FET works, how likely do you think my second FET will work?
I can't answer questions on success without knowing millions of details, guys. Like, you know, people literally spend all day in labs behind computers generating AI software programs that are designed to, you know, predict this stuff. And it's not predicting it just based on how likely was it from the first one. They need to know how fast did your embryo grow and what were the morphokinetics, which requires time-lapse embryoscopes, which we now have 2 of. It requires knowing, details about you. It requires knowing details about your partner. You got to put in the sperm parameters. Like these are complicated equations to figure that stuff out. It's not I had a 50% chance the first time, so now it's 50% chance again. It doesn't work like that at all.
Dr. V, Are there any circumstances in which you transfer two euploid embryos? If one doesn't stick, is that harmful to the other? Is the likelihood of twins with transferring two euploids high? Thanks,
Yeah, so we tried very hard not to do that, only in very, 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 very rare circumstances. I hate doing it, to be honest with you. So we try and only transfer one euploid at a time. The chances of twins is very high with two euploids, depending on which study you read, anywhere from 40 to 70% chance you're going to end up with twins. So it's extremely high.
From TikTok, I have had 6 miscarriages, all with fairly the same issues.
I don't know what the issues are. Tell me what your issues are. That's Tara, right?
Yeah.
I need to know your issues, Tara, then I can answer that question. Any type 1 pregnancy books you recommend, or pregnancy books in general? Big bookworm. The Holy Bible of Pregnancy is What to Expect When You're Expecting. It's reasonable. So that's a good book. I've read that. It's reasonable. That's a good start if you like being a bookworm.
Hello, Dr. V. Beta HCGs are not doubling, but they are increasing. Should I be worried? 15 DP 5DT 1000, 16 DP 5DT 2200, 19 DP 5DT 3600, and 20 DP 5DT 4500.
Okay, start that again. So on day, what was the first day?
13 5DT
And it was how high?
1000.
On 13 days post 5-day transfer. Okay. And then the next one was the next day?
16.
Oh, so from 13 to 16, right? And it was how high?
2200.
So that just scrapes by. It's a little on the low side. And then the next one was when?
19.
And on the 19th it was
3600.
So 2200, and then I went to 3600. So every 48 hours it needs to go up by a minimum of 60%. So 60% of 2200 would have been roughly 1240. So you're adding already 3400, and then you'd get another 30% the next day. So that's low. And then the next one is 3 days later and it's 4500. Yeah, that's unfortunately low. That's not normally rising, and you do need to be concerned about the risk of an ectopic pregnancy. So please go see your doctor. Yeah. Do I drink coffee? Carly is asking me. Only on weekends and when I'm post-call. Otherwise, no, because you want a steady hand when you're doing the stuff that we do, and you're not steady when you're hyped up on caffeine. I do love the coffee taste. And one of my patients is Colombian and keeps bringing me coffee. And so we keep the bag and snort it because it smells so good. It's like actual Colombian coffee.
That's great.
So we love the smell and I love the taste, but I don't drink it very often.
It's good for video games coffee, though. You can mash buttons like it's nobody's business.
Oh, Soraya's back on.
There you go.
Hi, Soraya.
Hi, Dr. Vainty. What do you do if FET after endo protocol is canceled for thin lining? Wait for a period and try again?
Small amount of estrase, don't cancel. Otherwise, yeah, you have to wait for a period and try again. But we use a minimum amount of estrase, 1 milligram a day, 0.5 milligram a day. Start low and go up from there.
Thoughts about the recall of endometrium? I used a bad lot last month for FET and ended up miscarrying. Anything I can do to know if I was contaminated from it?
Oh, that's a great question. I don't know the answer to that other than we don't actually use very much endometrium, just a little bit. But you could probably find out specifically what bacteria they were looking for, and they can do PCR testing. You probably have to talk to Ferring and see if that's something that was on their radar. So I would call Ferring. Keep in mind that the likelihood an infection was the source of a miscarriage is low, and the likelihood you got that infection from contaminated endometrium is even lower, because it has to go through the vagina into the uterus, which is not an easy path. There's thick cervical mucus which blocks it.
What are the success rates for IUI with 0% NF and all other testing seeming normal? Would this indicate IVF?
I think that's the same patient that asked this before. It's going to be low. I mean, you're probably looking single digits for your IUI success rate if you have no normal sperm. It's definitely going to be low. Soraya is definitely Arabic. Soraya is a common Persian name. It's a beautiful Persian name. It was the name of one of the queens of Iran.
Oh, really?
The Shah of Iran, I don't know if it was his first wife or his second wife, but her name was Soraya. Yeah, but she's Arabic because she just called me Habibi, which is not Persian, dude.
My love, my love.
Is that what Habibi means?
Yes.
All right. Oh, she sent us lots of kisses. Yeah.
Here's a great question. All questions are great, but this one, I don't know the answer. One spontaneous miscarriage.
Okay.
One ectopic. One missed miscarriage. Working with a fertility clinic now, but they didn't find a cause. Tried letrozole and now over to Clomid. When should I consider IVF?
Well, I would want to know. That's a great question, and I'm sorry for what you're going through. I would want to know what you've done and what more you need to do, and that kind of thing. So I think it would be important to reach out to us, ask for a consult, info@drvictory.com, and figure out if they did all the right testing for you first to figure out what's wrong. Certainly, letrozole and Clomid are not going to solve the problem at all, so that's useless. The bigger question is, can you get information that will help you and figure out what the problem is? And the answer is usually yes. So, there's this big kind of black box called unexplained infertility. And my good friend, Dr. Amy, the egg whisperer, and I have had this chat several times. We don't really believe that there's anything called unexplained infertility. There's just our inability to detect what it is that's wrong. So sure, there are some people where we don't have an explanation, so we label them as unexplained, but there's an explanation. We just aren't capable of figuring it out or haven't done sufficient testing to figure it out. Same thing is true for recurrent pregnancy losses and miscarriages. Yes, you can only find an answer in a small percentage of people, but the reality is that if you dig deep enough, you'll probably find an answer, which is why we use advanced testing for our clinic to figure out why things are not going the way that they should, if that actually occurs. So reach out, let's do a consult and figure out if you've done all the appropriate testing. I find a lot of the time other clinics say, oh, you had a negative thrombophilia screen, your genetics were normal, skip everything else, let's do IVF. Well, that doesn't answer what's wrong, and it doesn't actually necessarily solve the problem. If you've got an underlying immune disorder, you can do IUI or IVF till the cows come home. It's not going to make a difference. You still have an underlying immune disorder. So that needs to be explored in many instances first. 903.
Oh, okay.
Last question.
Sure. Let me try. Oh, okay. Okay, hold on.
Let me do this one. Is genetic testing covered in a government-funded cycle? No, not at all, Carly. It is not covered in a government-funded cycle. What is a standard IUI protocol for UNEX? Oh, unexplained infertility with no major issues. Clomid or letrozole? Any injections? Clomid and letrozole have been shown to have the exact same success rate with IUI for unexplained infertility, so it's whichever one you feel more comfortable with. We typically tend to use letrozole, but you could easily use Clomid. I usually divide it up for unexplained infertility based on age. You'll probably get more eggs with Clomid than you will with letrozole. So if the patient's older, I might tend to use more Clomid.
I got one. Last one.
Last one.
It's a good one.
Okay.
I keep hearing fertility specialists say losing 5% of your body fat will help regulate your cycle. Is those with PCOS specifically, and is this true?
Yes, it is true. There are many studies that show even a small amount of weight loss, 5%, can result in normalization and a huge improvement in your success rate. So that is very true. There are many studies that have shown that. All right, it is 9:05 and I am dead tired from a lot of travel recently. I hope you guys have an excellent evening. Next week on the show, we have, is that, that's our doctor from Miami, right?
Yeah, correct.
Yes. So we have a doctor joining us, a urologist from Miami. We will put out a post to advertise his presence. So if you have sperm questions, guy questions, if there are guys watching, please watch that show. This guy is brilliant, does all sorts of advanced research. They did some incredible research on the impact of cell phones on sperm. Really cutting edge technology as far as research. And he has very simple, wonderful presentation for explaining how to figure out male factors and things like that. So he's great. He's coming on with us. And I think his name is Dr. Ramasamy Ranjith. And then the week after, we have Elizabeth King, the fertility coach. And then hopefully Nathan Treff shortly after that, the genetics god. So I'm hoping we can coordinate all of those. And then we're going to start having more interviews. So we'll have more people on for you guys to grow questions from. Goodbye, Habibi, and see you next time live. What a great way to end this show. Good night, everybody. Have a good week, and we'll see you next week on